I'm Amy Bradley, and this is the GI Lab at Conemaugh Memorial Medical Center. If you're over 50, have a significant family history of colon cancer, or have signs or symptoms that need attention, it's time to speak with your physician about colonoscopy. Colonoscopy is a procedure in which physicians use a small tube with a camera on it to see inside the colon and rectum. It helps detect early signs of colorectal cancer and can help diagnose unexplained changes in bowel habits, abdominal pain, bleeding, and weight loss. Did you know that in the U.S., someone is diagnosed with colorectal cancer every 4 minutes, and one person dies from the disease every 9 minutes? That's the bad news. But the good news is it does not have to be that way.
The data clearly shows that if you do the screening at the appropriate intervals in the appropriate time frame, the amount of cancers that are caught are clearly almost always in the curable stage. If you do wait and decide that fear might prevent us from doing this procedure, unfortunately these people are the ones who are caught at later stages that really sometimes aren't curable.
I try to impress upon people how important colon cancer screening is. Colon cancer is one of the silent killers. You can be walking around with a cancer for 10 years and never know it's there. But it's also one of the cancers that gives us a chance for cure. Colon cancer is easily detectable. It's easily curable if it's found in the early stages, and one of the few cancers that we can say is totally preventable.
If screening can make colon cancer a preventable disease, why are people so hesitant to have a colonoscopy?
I think that the biggest fear for people to undergo screening is just the fear of the procedure itself. Now, I can say that this day and age, the concerns about sedation, the concerns about the procedure for screening are pretty much unfounded. Patients do very well, and I think it's very important that everyone gets screened at the appropriate age.
We've heard it all. It's scary, it's embarrassing, it's uncomfortable. Well, today we hope to convince you that colonoscopy really isn't scary. It's really not uncomfortable. And the staff here at Conemaugh are ready to do everything they can to make sure you end up like most of their patients that say, that wasn't bad at all.
I basically try to explain to them that this is a fairly simple procedure and should not take more than 10 to 20 minutes, and that we do thousands of these procedures on a regular basis, and we come across all different types of patients and take care of them, and they all do very well without any problems. And finally, I always try to tell them that the worst part of the test is the preparation, and as long as they've done that correctly, leave the rest to us and we will take good care of them, and they should do fine.
Let's walk you through what you'll experience when you come for your colonoscopy.
If they come up the elevator and they come to the waiting room, then we typically have a volunteer that signs them in, and then they are brought over here to the check-in station, and one of the secretaries will have them sign their consent forms for admission, just take care of some paperwork, and then we typically have them go straight to a room. And once they're in a room, we have a nurse come in and do their assessment. We start an IV. The family can be there with them.
By the time I come into the room, the patient is already situated well in their bed, and they are monitored. Their blood pressure, their heart rate, the oxygen in their blood, and their pulse rate are all monitored on the screen so that we know exactly what's going on with them from a medical standpoint. At that point in time, we reassure the patient and then give them the medications that would then put them in a light sleep where they are arousable but they are very comfortable. We introduce the scope into the rectum and gently advance the scope past the entire colon till the tip, the cecum, where the small bowel joins the large bowel, is reached. And on the way back, we carefully examine the walls of the colon, and if there is some residual stool, we try to wash those areas off and examine. And as and when we see the different things like polyps or tumors, we either biopsy them, or we cauterize them, or we completely excise them with the snares that we have, and we do other kinds of biopsies for, say, non-cancerous, non-polyp issues like colitis, etc., and finish the procedure and remove the scope.
Usually the procedure takes anywhere between 5 and 10 minutes to do. A little bit longer if you have to remove polyps, depending on how many and how big and a few other situations. But it's a very, very simple procedure. After the procedure, most people feel absolutely nothing.
Once their procedure's over, they're brought back out to the discharge area. Sometimes they're brought back into the same room that they were admitted into, and then we call their family back immediately. They're put onto a monitor to monitor their heart rate again, their oxygen level, and we typically then let them rest for a period of time, anywhere from 10 to 20 minutes, and then we sit the patient up, turn the light on, give them something to drink, and we're waiting for the physician to come out and discharge them. Once the physician sees them and goes over the findings, then we typically have the IV removed, and then the patient gets dressed, and they're all ready to go home. We like you to have a ride with you because you're not permitted to drive afterwards because of the conscious sedation, the medications that we are delivering during the procedure. And also, the medicine that we typically administer is an amnesic, and you typically forget what has been done. So when we're giving you your discharge instructions, we would like someone else to be there with you so that they have another ear to listen, so that when you get home, if you have any questions, you could refer to your family member.
Almost all the patients, after we go see them right after the test and they're awake, say, when are you going to do the exam? So I think that's a good indication of how simple this is. Colonoscopy is not only good for finding things, but when we do it, it's one-stop shopping. We can remove polyps if we find them. And by doing that, there's no chance of colon cancer in the future. So I think all in all, it's a very important thing to have done. It's not something to be afraid of. We have essentially painless techniques now for colon cancer. Our instrumentation is top-notch. The instruments are smaller, easier to slide in and take care of things. And with the addition of anesthesia services, it is essentially painless procedure. So it's certainly something to think about.
See? Not so bad. Colon cancer is preventable, and it's curable. So do not wait. If you're over 50 or have a family history of colon disease, talk to your doctor today.